Picture this. It's 2 a.m., and you're stumbling to the bathroom for the third time tonight. Your sleep's broken, you're exhausted, and there's this nagging heaviness in your lower abdomen that just won't go away. This was the reality for my patient, John, a 62-year-old retired teacher from Ohio, who thought his frequent urination was just part of getting old. But here's the kicker. It wasn't just age, it was his prostate crying for attention, and ignoring it could have led to bigger problems. Hi, I'm Dr. Helena, a physician dedicated to helping older adults live vibrant, healthy lives. Today, I'm diving into a topic many men over 50 shy away from: the surprising effects of daily masturbation on your prostate. Yes, it's a sensitive subject, but trust me, you need to hear this. If you're worried about aging, your health, or even your confidence, this video could change everything. Don't skip it. You'll regret missing these life-changing insights. To kick things off, drop a comment below with where you're watching from. Let's build a community of men taking charge of their health. Now, let's get started. Chapter 1: Why Your Prostate Matters. Your prostate is a small, walnut-sized gland below your bladder, but don't let its size fool you. It's a powerhouse, producing fluid that nourishes sperm and playing a key role in urination and sexual health. As you age, this gland can become enlarged, inflamed, or congested, leading to issues like frequent urination, discomfort, or even serious conditions like prostate cancer. Here's the good news. Many of these problems are preventable with simple, science-backed habits. But ignore your prostate, and you're rolling the dice with your health. John, my patient, learned this the hard way. For years, he dismissed his symptoms, too embarrassed to talk about them. By the time he saw me, his prostate was mildly enlarged, and his quality of life was suffering. Don't let this be you. Let's explore 3 biological changes that happen to your prostate when you masturbate daily, and why understanding them could save you from trouble down the road. Chapter 2: The Science Behind Daily Ejaculation. Daily masturbation might feel like a personal choice, but it triggers fascinating biological responses in your prostate. Let's break it down. 1. Hormonal balance. A temporary reset. When you ejaculate, your body briefly lowers levels of DHT, a hormone linked to prostate enlargement. Regular ejaculation gives your prostate short breaks from DHT's effects, potentially reducing the risk of growth. But here's the catch. Too much ejaculation can disrupt your hormonal balance, especially as testosterone naturally declines with age. Overdo it, and you might feel fatigued or notice changes in libido. 2. Pelvic health. A double-edged sword. Ejaculation involves muscle contractions in your pelvic floor and prostate, boosting blood flow and keeping tissues elastic. This can prevent hardening and improve urinary control. But overstimulating these muscles without rest can lead to tension, fatigue, or even weaker bladder control over time. Moderation is key. 3. Immune activity. Clearing the slate. Ejaculation helps flush out dead cells and waste from the prostate, reducing the risk of chronic inflammation, a silent culprit behind discomfort and disease. However, without enough recovery time, your prostate's immune responses can go haywire, causing low-grade irritation that feels like a dull ache. These mechanisms aren't just science. They're the difference between feeling vibrant or dragging through your days. John's story proves it. After years of neglecting his prostate, small changes like reintroducing ejaculation 1–2 times a week, paired with exercise and hydration, transformed his health. His nighttime trips to the bathroom dropped, and his confidence soared. Chapter 3: Finding the Right Balance by A. So, how often should you ejaculate to keep your prostate healthy? There's no one-size-fits-all answer. It depends on your age and health. Based on urology research and my clinical experience, here's a guide. Ages 40–49. Aim for 3–4 times per week. Your hormones are still robust, and your prostate recovers quickly. Ages 50–59. Scale back to 2–3 times per week. If you feel tired or notice urinary changes, ease up and check in with your doctor. Ages 60+. Once a week is usually enough to maintain circulation and clear the gland. Twice is fine if you're healthy and feel energized, but avoid overdoing it. The golden rule: listen to your body. Consistency matters more than frequency. Pair this habit with a balanced diet, light exercise like walking, and regular checkups to keep your prostate in top shape. Chapter 4: Breaking the Silence. Here's the real barrier: shame. Too many men avoid talking about masturbation or prostate health because it feels awkward or wrong after a certain age. But let me be clear. Taking care of your prostate isn't shameful. It's smart. It's no different from eating well or staying active. I've seen patients transform once they let go of embarrassment. One man, David, a 65-year-old from Nevada, told me, "I never thought something so simple could make me feel like myself again." His story isn't unique. By embracing small, science-backed habits, you can reclaim your health and confidence. You're not alone in this. Millions of men face the same concerns, and talking about it is the first step. That's why I'm here, to guide you with empathy and expertise. Closing. As we age, it's easy to feel like our bodies are slipping out of our control. But here's the truth. You have the power to protect your prostate and live with vitality. Don't wait for symptoms to force your hand like John did. Start today with one simple step, whether it's adjusting your routine, scheduling a checkup, or just talking openly about your health. You're not just watching this video, you're taking a stand for your future. I'm proud of you for being here. Drop a 1 in the comments if you're ready to prioritize your prostate health, or a 2 if you're still unsure but want to learn more. Let's start this journey together. And one last thought: your health isn't just about you. It's about being there for your family, your partner, your grandkids. Every step you take today is a gift to them and to yourself. Subscribe for more insights, and I'll see you in the next video. Stay strong, stay healthy, and know that you've got this.